Hi, I'm Ed Highland. This is ASH News TV, and I have the honor now of being joined by Dr. Linda Burns, who's the president of ASH. Dr. Burns, thank you so much for joining us. Another wonderful year here in San Francisco, and it's a record-setting year as well.
We're incredibly excited. This is the 56th annual meeting. The last time that we were in San Francisco was in 2008. We're delighted to be back again and delighted to share with you record-breaking attendance. So over 25,000 physicians and scientists interested in blood disorders will be attending ASH this year.
So much on the agenda, but I know one of the things you're really key to talk about are the Presidential Symposium.
The Presidential Symposium is named the Presidential Symposium because as president of ASH, you get to pick a topic that maybe you hold dear in your heart. I'm primarily a hematopoietic cell transplant physician, but in the transplant field, I focus on patients with lymphoma. And what is just amazing to me is how far we've come in our understanding of the pathophysiology, biology of this disease, and how it's driving approaches for new therapeutic options for patients. So I really encourage everyone to come. It should be a great session.
And that brings to mind what ASH is really all about, which is the science.
The science is really what drives the bench to bedside, which we talk about, but it's true. The science is what promotes the development of new therapies, and that's what we're all about, curing patients with hematologic disorders throughout the world. So the science at this meeting is going to be exciting. We are going to be highlighting the best of the best at the plenary session. We'll highlight 6 abstracts, and then there are late-breaking abstracts that we're excited about that we will also be highlighting in some of the immediate events that had really breaking news.
Are there any other sessions you'd like to highlight, Dr. Burns?
Yes, I would. We have one brand new session this year that's never before been offered. And this is to help the clinician, the doctor who's going to go home from ASH, and we've heard all this brand new science about all the new drugs, but how to go home and incorporate that into their practice. So the next day after ASH, they're going to be in clinic seeing a patient and trying to incorporate best practices. So this is a new session designed just for them. We'll be covering both non-malignant hematology as well as some hematologic disorders. So I encourage everyone to come, check it out, and give us your feedback. We think it'll be exciting. And
still another first, you are going to become the first president to be on Twitter.
I think that my children are going to be very proud of me, but I'm scared I'm going to make a mistake. But I understand that twitting, whatever they call it, I think it'll be a great way to engage with everyone. I have a hashtag, AskAshPres, so that's going to be on Saturday afternoon. So feel free, please. We want to hear your questions. It'll be fun.
Well, you know you've made it in life if you have your own hashtag, right?
I gather, I've arrived.
Dr. Burns, thank you so much for joining us here on ASH TV.
Well, this is the second year of ASH TV, and it has been a wonderful experience. We've had great feedback. Anyone attending the meeting from anywhere, their hotel room, can tune in, see the highlights of the day. So thank you for being with us, and we enjoy working with you.
Well, we enjoy it as well, and we certainly hope to have a long-standing relationship with you as well.
Thank you.
Thanks so much, Dr. Burns. And this is ASH News TV.